Hi, I'm Dr. Al Costanza, functional medicine clinician and educator. I want to talk to you today about cancer. Statistically, 1 in 3 men, 1 in 2 women will be diagnosed with cancer in their lifetime, and in total, it represents about 40% of the population. So I put together what I call my cancer algorithm, and I'd like to. This is what it looks like. I'll at some point post it online, and I'd like to go over that with you. I've been in practice for about 33 years, and a number of my patients, we've done an integrative approach with cancer sufferers. So in my first column I have here is immunity. Immunity is number one. So in about 70 to 80% of the immune system comes from the gut. When I say the gut, I'm talking from the sinuses down to the other end. We refer to this mucosal membrane with the immune system resides in the gut as our terrain. And the terrain is number one. The pathogen, the microbe, is secondary or tertiary. And as you probably know, if you know someone that's had cancer, it's not unusual that they'll put you on an immunotherapy program, or in a trial with immunotherapy, or you're getting a placebo. Next is environmental. When I say environmental, things that we pick up from childhood, it's not so much what you touch is what you breathe. And we call them xenobiotics, xenoestrogens. So this can be anything from products that people use in the workplace, particularly people in the trades, or someone who's a hairdresser, breathing all that perm stuff that they use, and that can't be good for you, or the women that do the nails, and breathing all those chemicals. And it's in our food, it's in our water supply. We live in a world of sea of chemicals. The next one is lifestyle factors. So first and foremost is diet. Keep in mind the diet that serves person A does not for person B makes person C sick. But if you want to prevent cancer, you have cancer, a very strong plant-based diet is essential. I can't emphasize that enough. Eating a high animal protein diet, that is not conducive, particularly if it's not pasture-fed, pasture-raised. That can be a problem. Though I will make an exception, and there are some people who temporarily do a keto diet. That's a diet that can actually help to reduce the risk and help to resolve cancer. What else? Exercise is the elixir of life. You got to keep moving. Sleep, stress, diffuse the stress response. You can't tell someone how to feel, but you can do things that diffuse the stress response. I call it holistic somatic therapies. Our emotions. I found out over the years that there are people that are diagnosed, they hear the C word, and they just fall apart, and that's it. And they're done. Most people are, they say to themselves, I've got a loved one or loved ones, I have a career, I have a life, it's not my time yet. And these are the people that are the survivors. I often say the ultimate endogenous influence of the human body is our brain, and that is so important. The next one is our foundational health. What makes up our foundational health? Well, part of it's our immune system, which starts with the cells, and particularly the mitochondria, those little powerhouses within the cell. You have about 500 to 3,000, and that plays a major part in our health. Along with insulin and hormones. There is a component with insulin resistance and cancer. And what else? Oxidative free radicals, or referred to them as ROS, reactive oxygen species is the technical name for that, but free radicals. Inflammation, or in functional medicine we call it inflammaging. As we get older, we become more inflamed. We become more insulin resistance. We become more leaky, intestinal hyperpermeability, leaky gut. We become more acidic. Cancer thrives in an anaerobic environment, lack of oxygen. It thrives with an acidity. The next is detoxification. Genetically, some people are good detoxifiers, some are not. If you're not, doesn't mean that you're doomed. There are things you can do to step up detoxification. And we have a number of different programs that I've administered over the years that helps patients. It's really all about the liver. In my opinion, the liver is the most important organ of the body. Well, you probably say, well, Dr. Al, the heart's kind of important. Yeah, the heart's important. But the liver, it has so many functions, over 500 functions. And last is genetics. Now, as time goes on, genetics statistically is responsible for less and less disease. It started off as, 70%, and now it's down to like 5 to 10%. I think in years to come, it might get down to 1% and so forth. So in any event, there are a lot of things one can do to reduce the risk for cancer. And I've personally developed a number of different custom formulas for that purpose. And if anyone's interested in talking to me about any of this, they can find me on my website, which is dralcostanza.com, dralcostanza.com, and they can book their initial free consultation. So in the meantime, stay well, stay educated, be your best advocate. No one cares about you more than you. Bye-bye.